Guys, I'm Sharith today. Today I'm going to present to you short summary on the topic colony stimulating factors. So let's begin. Subtopics to be covered in this chapter are introduction, formation of CSF that is colony stimulating factors, functions of CSF, types of CSFs, mechanism of action, its medical applications, side effects and safety, and some MCQ points regarding it. So, what are CSFs? CSFs are glycoproteins that bind to JAK or STAT type of receptors on surface of hematopoietic stem cells, thereby activating intracellular signaling pathway that cause the cells to proliferate and differentiate into a specific type of blood cells, usually WBCs. So, these CSFs are also called as growth factors. Formation of CSF. These CSFs are naturally produced by mature fibroblasts, endothelial cells, macrophages, and some other types of cells, as described in the diagram. What are functions of CSF? These CSFs stimulate photosynthesis, superoxide production, and function of neutrophils, monocytes, and eosinophils. Erythropoietin is a CSF responsible for colony forming units of erythroid series. Recombinant forms like interleukin 3, monocyte macrophage CSF, that is MCSF, and stem cell factor have been produced. Now, types of CSF. There are mainly two types of CSF: granulocyte CSF and granulocyte macrophage CSF. First, what are granulocyte CSF? Examples of these are filgrastim. Filgrastim is a recombinant GCSF used in stimulation of colony forming units of gametocytes to increase neutrophil production. This also reduces period of neutropenia and reduces opportunistic bacterial as well as fungal infections. Second GCSF is linograstim. This is a glycosylated form of recombinant GCSF which activates neutrophil recovery after myelosuppressive chemotherapy and also reduces the risk of life-threatening opportunistic bacterial as well as fungal infections. These assist in neutrophil recovery in patients undergoing bone marrow transplantation. Now, granulocyte macrophage CSF. Again, it has two examples. Sargramostim. This is a recombinant version of human GM-CSF, that is granulocyte macrophage CSF, that normally induces progenitor cells to differentiate into neutrophils, monocytes, macrophage, and myeloid-derived dendritic cells. Adverse effects of this include bone pain, chills, fever, flushing, dyspnea, etc. Second GM-CSF is mulgramostim. This is recombinant GM-CSF that stimulates partially committed hematopoietic progenitor cells to produce mature granulocytes, monocytes, and macrophages, and also enhances their functions. This is used to reduce severity of neutropenia. This also fastens myeloid recovery after bone marrow transplantation. Now, we come to the mechanism of action. How these CSFs act. CSF work by binding to specific receptors on the surface of bone marrow cells, stimulating their proliferation and maturation into white blood cells. Then, this binding with receptors helps in increasing the production of neutrophils and other immune cells. These are typically administered as injections, either subcutaneously or intravenously, depending on the specific drug and indication. Now, what are the medical applications of CSF? There are many medical applications. Some are listed. These are managing neutropenia associated with chemotherapy, radiation therapy, or bone marrow disorders. Second, mobilization of hematopoietic stem cells for transplantation. CSFs are used for treatment of certain types of leukemia and myelodysplastic syndromes. These also facilitate recovery after bone marrow or stem cell transplantation. Now, what are the side effects of CSF and safety to be taken? Common side effects include bone pain, fever, fatigue, and injection site reactions. Patients receiving CSF should be closely monitored for their white blood cell counts, and treatment might need to be adjusted based on their response. These are contraindicated in patients with hypersensitivity to the drug and should be used with caution in patients with certain medical conditions. So I guess you must so I guess you get the topic. Now we'll discuss some MCQ points regarding this topic. First, what is the primary function of colony stimulating factors? First option, anti-inflammatory response, immune cell proliferation and differentiation, blood clotting or hormone regulation. So immune cell proliferation and differentiation is the most appropriate answer. Second, which type of CSF stimulates the production of red blood cells? GCSF, GM-CSF, erythropoietin and TPO. So for red blood cells, if the production of red blood cells is asked, the most appropriate answer will be erythropoietin CSF. Then, which CSF is primarily responsible for promoting the growth and differentiation of white blood cells, including neutrophils and monocytes? GCSF, GM-CSF, erythropoietin or TPO. So if growth and differentiation of white blood cells is asked, then the option is granulocyte colony stimulating factors, that is GCSF. Second, in which condition would the administration of GCSF be most beneficial? Anemia, thrombocytopenia, neutropenia or hypertension. So for administration of GCSF, most beneficial condition is neutropenia. Next, which CSF is used in cancer patients to stimulate the production of white blood cells after chemotherapy? GCSF, GM-CSF, erythropoietin or TPO. So for white blood cells after chemotherapy, most appropriate answer will be granulocyte colony stimulating factors. Thank you everyone.